Welcome to the deep dive.
Yeah.
Today, we're going to be diving deep into Class III Malocclusion.
Oh, very interesting.
You might be thinking, what is that?
Yeah.
In the simplest terms, it's when your lower jaw sticks out farther than your upper jaw, sometimes called an underbite.
Right.
But we're going to go way beyond just the basics.
Okay.
We're going to unpack the causes, dive into the different types,
Sounds good.
explore a whole range of treatment options.
Okay.
We're going from simple appliances to more complex procedures.
Oh,
We've got some great sources lined up for this, including research articles, clinical studies, and we're really excited to share some really fascinating insights with you guys today.
Hey, awesome.
And to guide us on this deep dive today, we have an expert who eats, sleeps, and breathes orthodontics.
I do.
So let's jump right in. Can you give us a simple breakdown of what causes Class III malocclusion?
Well, it's not just one thing.
Good.
It's a really fascinating mix of genetics and environmental factors.
Genetics, so like a family history of jaw issues.
Exactly. Genes play a huge role, but it's not just about inheritance.
Ah.
Habits like mouth breathing or thumb sucking can also influence jaw development.
Huh, interesting.
Think of it like this. The environment can either help or hinder what your genes have in store.
Oh, so it's like a nature versus nurture battle happening in our mouth.
Precisely. And it's this interplay that makes diagnosing and treating Class III malocclusion so interesting.
That is very interesting.
Yeah.
And when we talk about jaw development, are we talking strictly about the teeth, or is there more to it?
That's a great question.
Yeah.
It's actually not always about crooked teeth.
Okay.
Sometimes it's the jaw bones themselves that are misaligned.
Right.
We call this skeletal Class III.
Okay.
Imagine the bones themselves, the maxilla, that's the upper jaw, and the mandible, the lower jaw,
Right.
not fitting together properly. That's skeletal.
Gotcha.
But then we have dental veolar, where it's more about how the teeth are positioned within those bones.
Yeah. So the bones can be perfectly fine, but the teeth are causing the underbite.
Right.
Oh, wow.
And to make things even more interesting, there's a condition called pseudo-Class III.
Okay.
It mimics a true Class III, but the underlying jaw structure is normal.
Oh, so it's kind of like a dental illusion?
It is. It's like a dental illusion.
How is that even possible?
Well, the way the teeth meet and the angle of the lower jaw, specifically the gonial angle,
Right.
can make it seem like a skeletal issue when it's not.
Wow.
It's crucial to differentiate because the treatment for pseudo-Class III is different from a true skeletal Class III.
Okay, so we've got genetics, environmental factors, and even a little bit of dental trickery going on.
Yeah.
This is getting complex.
It is.
How do orthodontists even begin to predict how a child's jaw will grow and whether they might develop this malocclusion?
You're right. Predicting growth is one of the biggest challenges that we face.
Yeah.
There are methods to assess growth potential,
Okay.
but they're not 100% accurate.
Right.
We can look at things like hand-wrist radiographs, cephalometric analysis.
What's that?
That's basically analyzing specialized x-rays of the head.
Okay.
And we can do genetic testing, but there's always a degree of uncertainty.
You're saying there's no crystal ball for jaw growth.
Not yet.
Right.
And to add another layer of complexity,
Okay.
boys and girls don't grow at the same rate.
Oh, right, right.
Girls tend to have their growth spurts earlier, usually between 9.5 and 12 years old,
Okay.
while boys hit theirs later around 14 to 16.
So taking all of this into account, if you suspect a child might be developing Class III malocclusion, would you say that early intervention is key?
Absolutely. Early intervention is all about harnessing that growth potential and guiding the jaws towards a more harmonious development.
Okay.
It's like setting the stage for a beautiful and healthy smile.
Okay, but what are the signs that a child might benefit from early intervention? And what exactly are we hoping to achieve with this early treatment?
Well, several factors come into play. We look at the severity of the underbite, of course,
Right.
but also things like facial symmetry
Okay.
and how the teeth fit together. Family history is important too.
Right.
Are there other family members with jaw issues?
Oh, yeah, that makes sense.
And perhaps most importantly,
Yeah.
we need to assess patient cooperation,
Oh.
because even the best treatment plan won't work if the child isn't on board with wearing their appliances.
Yeah, absolutely. So it's a team effort.
Yes.
It's the orthodontist, the child, and the parents.
Right.
All got to be working together
Exactly.
to make sure everything's going smoothly.
Yes.
So now let's talk treatments.
Okay.
We've touched on some already, like those functional appliances. Could you break down some of those options for us?
Sure.
Starting with that pseudo-Class III we talked about earlier.
Okay, so because pseudo-Class III is usually more about tooth position than jaw structure,
Right.
we can often correct it with relatively simple appliances.
Okay.
Think of things like reverse crowns, which are basically crowns placed on the back teeth
Okay.
to encourage more forward bite.
Gotcha.
Or a lingual arch, which is a wire that goes behind the lower teeth to help guide their position.
So those are for pseudo class 3.
Mm-hmm.
What about treating true skeletal class 3?
Okay.
That sounds a little more complex.
It can be.
Yeah.
What are the most common appliances we use is called a reverse pull face mask or a protraction face mask.
Okay.
It's designed to gently pull the upper jaw, the maxilla, forward.
A face mask that pulls the jaw forward.
Yeah.
That sounds intense.
It's not as scary as it sounds.
Okay.
It's basically a framework that fits around the head with elastics or springs that attach to a bar in front of the teeth.
Oh, okay.
It's worn for a certain number of hours each day,
Okay.
gently guiding the upper jaw into a better position.
I bet kids love wearing that to school.
It can take some getting used to,
Yeah.
but the results can be quite impressive.
Wow.
It's especially effective in younger patients whose jaws are still growing.
So that's the face mask for the upper jaw.
Mm-hmm.
What about the lower jaw, the mandible?
There are a few options for managing mandibular growth.
Okay.
One that you might have heard of is the chin cup.
Okay.
It's literally a cup that fits under the chin and applies gentle pressure to help redirect the growth of the lower jaw.
So it's like putting the brakes on excessive jaw growth.
That's a good way to think about it.
Okay.
But there's actually some debate about whether it truly inhibits growth or simply redirects it.
Oh, interesting.
And the chin cup is not without its downsides.
Right?
It can be uncomfortable,
Yeah.
and some patients find it difficult to wear consistently.
And consistency is key with any orthodontic treatment, right?
Absolutely.
Like if you don't wear the appliance as directed,
Yeah,
you're not going to get the results you're hoping for.
exactly. Patient compliance is essential, especially with functional appliances.
Right.
They rely on the forces of muscle activity and growth to work their magic.
You mentioned functional appliances, but I know there are also fixed appliances like traditional braces.
Yeah.
How do those fit into the picture?
Fixed appliances, like braces, are primarily used to move teeth.
Okay.
While they can play a role in Class 3 treatment,
Uh-huh.
they're often used in conjunction with other appliances to achieve the best results.
So it's like a multi-pronged approach using different tools
Mm-hmm.
to address both the skeletal and dental aspects.
Exactly. It's about creating a customized treatment plan based on each patient's unique needs.
All of this sounds great for kids whose jaws are still growing.
Mm-hmm.
But what about adults? Are there options for them too?
That's a great question.
Yeah.
While it's ideal to address skeletal discrepancies during growth,
Right.
there are still options for adults.
Like what? Fill us in.
Well, for those with mild discrepancies,
Oh.
camouflage treatment with braces or clear aligners can create a more aesthetically pleasing smile
Right.
without resorting to surgery.
So it's about making the most of what you have, even if you can't completely change the underlying bone structure.
Exactly.
But for cases with significant skeletal discrepancies,
Yeah,
surgical intervention might be necessary.
it might.
And this typically involves a procedure called orthognathic surgery, which aims to reposition the jaws into a more harmonious relationship.
Yes.
So it's not just about moving teeth, it's about reshaping the jaw bones themselves.
Correct. Orthognathic surgery is a major procedure,
Yeah,
and it's not something we take lightly,
of course.
but for some patients, it can be life-changing.
And I know we briefly mentioned implants earlier. How do they factor into Class 3 treatment?
Implants can be used as anchors
Okay.
to provide more precise control over tooth movement.
Okay, so picture this.
Yeah.
You've got an implant, which is like a small titanium screw
Right.
placed in the jawbone, and it acts as a solid anchor point, allowing the orthodontist to apply forces to move teeth in a very specific way.
Exactly. And because implants are so stable,
Right.
they can be really helpful in managing complex cases,
Wow.
especially when you need to move a lot of teeth
Okay.
or make significant changes to the bite.
This is all incredibly fascinating. It really highlights how far orthodontics has come,
OS.
offering a wide range of options to address even complex cases like Class 3 malocclusion.
Absolutely.
We've covered a lot of ground in this episode.
Oh, we have.
From the causes and different types of Class 3 malocclusion to the amazing array of treatment options available.
Yes.
But before we wrap up this part of our deep dive, I want to pause here
Okay.
and take a moment to clarify some of the key terms we've been using.
Sure.
I think it's important to define these terms.
Yeah.
So you, as the listener,
Yes.
have a solid understanding of the language we're using.
Of course.
Let's start with malocclusion itself.
Okay.
Can you break down what that actually means?
Malocclusion simply means bad bite. It refers to any misalignment of the teeth or jaws.
Mm-hmm.
We've been focusing on class 3, where the lower jaw sits forward of the upper jaw.
Right.
But there are other classifications, too,
Right.
like class 1 and class 2.
And you mentioned earlier skeletal versus dental veolar.
Yeah.
Can you explain that again?
Sure. Skeletal refers to the actual bones of the jaw.
Right.
The maxilla and mandible being misaligned.
Right.
Dental veolar means the teeth are positioned incorrectly within the jaw bones.
Okay, so it's important to distinguish between those two because the treatment will differ depending on whether it's a skeletal issue or a tooth positioning issue.
Exactly. And now diving a little deeper into some treatment terms,
Okay.
we often use functional appliances.
Right.
Can you remind us what makes an appliance functional?
From what I understand, they work by utilizing the natural forces of your muscles and jaw growth to guide development.
Yeah,
Kind of like a workout for your jaw.
that's a great way to put it. Unlike braces, which focus on moving teeth, right, functional appliances aim to actually change the growth pattern of the jaws themselves.
So if you catch a class 3 malocclusion early enough, you might be able to correct it without ever needing braces.
That's the goal. Early intervention allows us to harness the power of growth
Right.
and potentially avoid more invasive treatments down the line.
This has been an incredible deep dive into a condition that I think many people may not have even known existed before.
Yeah.
But it's definitely more common than people realize, and it's something we should be talking about more.
We should.
So we've covered a lot of ground, from the causes and types of class 3 malocclusion to the amazing array of treatment options available.
We have.
And most importantly, we've emphasized that this condition is more than just an aesthetic concern.
Right.
It's a functional issue that can impact a person's overall health and quality of life.
Absolutely.
But with early detection, a collaborative approach between the patient, parents, and the orthodontist, and a willingness to explore all the options, there's hope for successful management and a brighter smile ahead.
Absolutely.
So keep those jaws healthy, those smiles beaming, and remember, knowledge is power. Until next time, keep diving deep into the fascinating world around us.